Hello friends, how are you? I hope you all are good. Okay, so today I'm going to discuss the most important topic of the dental. Okay, so which is that means like tooth development. It is the most important question for your exam. Okay, it is the most important question. So if you write how much I have given in this video, the slides which I have shared, if you write that much also, it's more than enough because I have given the point to point. Okay, so stay till the last, see the all the slides, take the screenshot, make it the notes and study it properly. If you write this much also, it's more than enough. I have given the most important points to be written in the exam paper. Okay, so let's begin the topic. Okay, tooth development. Okay, basically this is tooth development is first we'll see the definition. Okay, this is also called as odontogenesis. Okay, this is the process by which teeth is developed from the oral epithelium, okay, underlining the ectomesenchyme, resulting in the formation of enamel, dentin and cementum and periodontal ligament and pulp. Okay, these are the stages. Okay, bud stage, cap stage and bell stage. Okay, so this is how the teeth is formed. Okay, you can see epithelial mesenchyme, enamel knot, you can see enamel organs, you can see dental papilla, then dental follicle, then amelogenesis, then the tooth is formed. Okay, now we'll see in detail about the stages of tooth development. Okay, first is like there morphologically there are four stages. Okay, bud stage, cap stage, bell stage, root formation stage. Okay, so first we'll see the initiation stage, which is bud stage. Okay, this is how the bud stage, this diagram you have to draw in your examinations because this is the diagram, is a self-explanatory. Okay, take it the screenshot and make the notes of it. Okay, so definition of birth stage is, this is the first morphological stage of tooth development. Okay, characterized by localized proliferation of oral epithelium into the underlying ectomesenchyme, forming the tooth bud. Okay, next this is also the diagram you have to draw like same it is, and you have to draw like this. Okay, the diagram part. So time when this time of occurrence is mainly begins in the sixth week of intrauterine life. Okay, sixth week of intrauterine life it gets started. Okay, corresponding to the formation of primary tooth germ. Okay, permanent tooth bud develop later from the dental lamina. Okay, now later on the permanent dentition will develop from the dental lamina. Okay, so next is histological events. What are the events you can see in the bud stages? Oral epithelium thickness to form dental lamina. Oral epithelium get thickness to form dental lamina. Okay, cells of dental lamina proliferate downwards into the ectomesenchyme. Okay, dental lamina, what will happen, that proliferate into the ectomesenchyme. Each downward growth forms a tooth bud. Everything get downward na, so it look like a bud, so it is called tooth bud. Ectomesenchyme show condensation around the bud. Okay, so next we'll study in detail. Okay, histological features. Okay, dental lamina appears as a band of satisfied squamous epithelium extending from oral epithelium into the ectomesenchyme, give rise to the tooth bud. Okay, so next this is how the dental lamina look like. See epithelium tooth bud, how it is going downward and forming a bud. Okay, condensation of ectomesenchyme you can see down in the downward region. Okay, so cells, which are the cells are closely packed. How cells look? Cells are closely packed, large nuclei, minimal cytoplasm. Okay, this diagram also take the screenshot and practice it many times so that you can remember each and every labeled. Okay, so next is tooth bud. It is a round or oval epithelium mass. Okay, composed of entirely of epithelial cell, uniform cell population. Okay, no differentiation into the layers. Okay, represent the future enamel organ. Okay, so next is ectomesenchyme. How it look like? Derived from the neural crust cells, show cellular condensation around the tooth bud. Okay, here the cells are spindle shape, densely packed. Okay, this condensed ectomesenchyme of later form dental papilla and dental follicles. Okay, each point remember it very properly. Okay, so this is how this is also a diagram I have kept. And next is basement membrane. Okay, separate tooth bud epithelium from the ectomesenchyme. Okay, further sites are dentin and enamel interaction. Okay, important for epithelium mesenchymal signaling. Okay, next is cellular characteristic: high mortality activity in the epithelial cell, no amyloblast or odontogenic blast at these cells. Okay, cells are undifferentiated. So next is molecular and functional significance: establish number of tooth. Here the tooth bud will get developed, number of tooth we'll see, position of the tooth we can see. Okay, controlled by genetic signaling between epithelium and ectomesenchyme. Okay, next clinical significance of this stage is developmental distribution between during the initiation stage. This, like, if any disturbances, if it occur in this stage, causes the absence of the tooth, missing tooth, supernumerary tooth. Okay, so this is the diagram again I have kept so that you can remember it and take a screenshot and practice it properly. Okay, so conclusion of this stage is the birth stage marks the beginning of the tooth development, where tooth number and position are determined. Although no hard tissue formation occur at this stage, is crucial for normal odontogenesis. Okay, so what are the questions they might ask in Viva about these stages here? When does the tooth bud occur? What is dental lamina? Which anomalies occur during the initiation phase? Origin of ectomesenchyme. Okay, so next stage is cap stage. Okay, this is how the diagram look like. Practice is properly. Okay, so definition of the cap stage is: the proliferative stage, also called the cap stage, is the second stage of the tooth development, in which the tooth bud proliferate unevenly and assume a cap-like appearance, leading to a formation of three important component, that is enamel organ, dental lamina, and dental follicles. Okay, so time of occurrence is 8th to 9th week of intrauterine life. Okay, followed by the bud stage. Okay, proceed next, it will lead to the bell stage. Okay, so what are the histological events you will see here? Continued proliferation of dental lamina cells, unequal growth causing the epithelial to fold. Okay, cap shaped structure is formed, condensation of ectomesenchyme increases. So what are the components of cap stage are: enamel organ, okay, derived from oral epithelium, responsible for enamel formation. Okay, what histological features appear as cap shaped epithelial structure. Okay, composed of outer layer of cuboidal cells, inner layer tall columnar cells, central loose arranged cells, centrally loosely arranged cells. Okay, so this is how the enamel organ look like. Okay, so this is the cap stage ka diagram. Okay, so next is dental papilla, formed by condensed ectomesenchyme beneath the enamel organ. What are the how the cells? Closely packed, rich in blood supply. Okay, what are the further role? Peripheral cells leads to odontoblast, central cells leads to dental pulp. Okay, so next is dental follicles or dental sac, surround enamel organ and dental papilla. Okay, consist of loose ectomesenchymal tissues. Okay, so the further role is cementum. That form cementum, PDL, alveolar bone. Okay, so histological features of enamel organ. Okay, outer enamel organ. Okay, how it will, what are, you can see cuboidal cells, protective protective function, maintain shape of the enamel organ. Next is inner enamel epithelium. Okay, tall columnar cells face the dental papilla, later differentiate into the amyloblast. This is how the cap stage look. Okay, so next is stellate reticulum. How this is, central loosely arranged star shaped cells. These are the star shaped cells. Okay, this is the main point. Okay, secrete glycosaminoglycan. Okay, provide cushioning and nutrition. Okay, next is basement membrane, separate inner enamel epithelium from dental papilla, further site of enamel dentin junction. Okay, important for epithelium mesenchymal interaction. So next is functions. What are the functions? Determine the shape of the crown, cuspal pattern, establish tooth basic tooth morphology. Okay, what are if any disturbances, what we'll see: abnormal tooth shape, germination, fusion, enamel organ, cyst. Okay, this is how the cap stage look. Okay, draw this diagram properly. So conclusion of the cap stage: the proliferation or cap stage is a critical phase in teeth development where tooth germ components are established and the basic crown forms is determined, paving the way for further differentiation. Okay, next, which are the most important questions during the viva is why it is called cap stage. Okay, components forming during the cap stage, then role of dental papilla, function of stellate reticulum. Okay, next is bell stage. Okay, this is the early bell stage ka diagram. Okay, here early and late bell stage both you can see. Okay, this is the early bell stage ka diagram. Next is advanced bell stage, also known as late bell stage. Okay, this is the diagram. So definition of this bell stage is the histodifferentiation stage, also called the bell stage, the phase of tooth development in which the cells of the enamel organ and dental papilla differentiated into the specialized cells responsible for formation of enamel, dentin and pulp. So time of occurrence occur after the cap stage around 11th or 12th week of intracranial sorry intranatrial life, intrauterine life. Okay, proceed the pulsation stage. Okay, the characteristic features: enamel organ become bell shaped, extensive cellular differentiation, to, tooth crown shape become more defined, beginning of functional specialization of cells. Okay, next is components. What are components you will see in the bell stages? Enamel organ. During the bell stage, enamel organs show four distinctive layers. Okay, in that first one is outer enamel epithelium. What it consists of: low cuboidal cells located on the outer surface. Then what are functions? Protect the layer, maintain shape and size of the enamel organ, regulates exchange of nutrients. So next is inner enamel epithelium. Tall columnar cells face the dental papilla. Okay, nucleus shift away from the basement membrane. This is the most important point. Okay, and while you are drawing, when you are drawing the diagram, be careful where you keep the nucleus. Okay, nuclei. Okay, cells differentiate into amyloblast. Okay, next stage is stellate reticulum, star shaped cells with long cytoplasmic process. Okay, secrete glycosaminoglycan. Okay, what are the function? Protection, maintain the shape of the crown, development, nutritional support. Okay, next is dental papilla, derived from condensed ectomesenchyme. Here highly vascular cells differentiate into peripheral cells, goes to amyloblast, central cells forms the dental pulp. Okay, next is basement membrane, separate inner enamel epithelium and dental papilla. Okay, further sites is dento-enamel junction. Okay, the important for epithelium mesenchyme interactions. So type of bell cell, bell stage, that is early bell stage and late bell stage. In early bell stage, what will happen? Cell differentiation begins, no hard tissue formed. Okay, in later bell stage, that is advanced stage, cells are fully differentiated, prepared of apposition stage, prepares for apposition stage. Okay, next is functional significance, determine what it will the type of the tooth, incisor, canine or molar. Okay, shape and size it will determine this stage, establish enamel and dental forming cells. Okay, the clinical distribution, what will amelogenesis imperfecta you can see, dentogenesis imperfecta you can see, abnormal crown morphologies you can see if anything happen in this stage. Okay, this is the early bell stage diagram. Draw it properly. Next is advanced bell stage ka diagram. Okay, so what is the conclusion? The his histodifferential or bell stage is a crucial phase where cells acquire their specific function, setting the foundation for hard tissue formation and normal tooth structure. Okay, if these are the important viva questions. Okay, So next is root formation. This is how, this is the diagram, most important diagram. Okay, this is 5 mark question, so know it, draw this properly. So next, definition of root formation. Root formation is the process by which the root of the tooth develop after completion of crown formation, mainly under the influence of Hertwig epithelial root sheet, that is called HERS, leading to the formation of root dentin, cementum and periodontal ligaments. Okay, see this diagram. Next is time occurrence. Begin after the crown is completed. Continue until tooth eruption and functional occlusion. Take several years. Okay. Next is role of Hartwig epithelial root sheet. Formation is formed by inner enamel epithelium, outer enamel epithelium, cellate reticulum, and stratum stratum intermediate are absent. Okay, next structure, double layer epithelial sheet extends apically from cervical loop, okay, surround dental papilla at the further root area. Okay, next is functions. What are the function of Hartwig epithelial root sheet? Determine the shape of the root, length of the tooth, number of roots. Okay, these are the functions. Okay, process of formation of root formation. How? Elongation of Hartwig epithelial root sheet. In that, what happened? Cervical loop proliferate apically, okay, forming a tube-like structure around the dental papilla. Guides root shape. Okay, next is differentiation of odontoblast. Cells of dental papilla adjacent to Hartwig epithelial root sheet differentiate into the odontoblast. Odontoblast lie down root predentin. Okay, predentin mineralize to form root dentin. Okay, next is disintegration of HERS. Okay, after dentin formation begins, Hartwig epithelial root sheets break down, allow dental follicles cell to connect root dentin. Okay, formation of cementum. Dental follicle cells differentiate into cementoblast. Cementoblast develop cementum over the root dentin. Okay, types acellular cementum and cellular cementum. So formation of PDL, remaining dental follicle cells differentiate into fibroblast, leads to PDL, periodontal ligament fibers. Odontoblast leads to alveolar bone. Formation of epithelial rest of melissus. Remnants of Hartwig epithelial root sheet persist into the periodontal ligaments known as epithelial rests of melissus. Clinically important, give rise to cyst. Okay, root formation in multi-rooted tooth. Hartwig epithelial show horizontal inward growth, forming epithelial diaphragm. Divide root trunk into 2 or 3 roots, determine their functional area. So apical foramen, continuous root elongation reduces apical opening. Okay, so apical foramen forms near the root completion, allow passage for nerves and blood vessels. So clinically important, incomplete root formation seen in young permanent tooth, traumatized tooth. Okay, errors in Hartwig epithelial root sheet may be short rooted, decelerated, important in endodontic treatment, apexogenesis and apexification. Okay, this is the diagram you have to draw for epithelial root sheet. Hartwig epithelial root sheet. Okay, conclusion. Root formation is a highly regulated process controlled by Hartwig epithelial root sheet, leading to a proper formation of root dentin, cementum, periodontal ligaments, and apical foramen. So these are the important viva questions. Okay. See, this is how bell stage, bud stage, cap stage, bell stage ka advance. Okay, this is how the root formation. These are the stages. Okay. Again, here the bud stage, cap stage, and bell stage. This is the Hartwig epithelial root sheet. Okay. Thank you. I hope you like this video. If you write this much also in your exam paper, it's more than enough. Make write down in the notes and practice the diagram as many times as possible so that you remember. And it is the most important question for first year BDS. So study it properly. I hope you like the video. Thank you, and do like, share, and subscribe my channel. Thank you.